So it's my great pleasure to talk to Dr. Hu. And thank you for giving the keynote on the second day of the New Wave for AI in Healthcare conference. Your work is, of course, trailblazing in our discipline. And what I'm very interested in currently, I think all of IBM research and you yourself are really doubling down on foundation models, which I think makes a lot of sense, especially also in healthcare. So how can foundational models and generative AI really advance our field, especially if you think about the medical domain?
Yeah, so first of all, thank you very much for having me. We are clearly at a very momentous moment in AI in general, but AI in healthcare in particular, and so it's really exciting to be here. AI foundation models and generative technologies can really advance healthcare in two different ways. One is it can enhance productivity. We see that happening really across many industries already. And in fact, the new AI platform that IBM just announced a couple of weeks ago is focused on helping enterprises achieve this level of productivity enhancement from foundation models. Now, for healthcare in particular, we envision enhancements in productivity in many ways. For example, reducing the amount of paperwork for clinicians. It can also help the interaction between clinicians and patients, help with making difficult diagnoses, as well as making clinical trials more efficient and better monitored. Now, this is also related to access because the incredible assistive capabilities of AI foundation models can really have the effect of promoting the democratization of medicine and wider access to quality care for particularly people who are less privileged from underdeveloped regions. So interestingly, technically speaking, this particular use case is actually relatively straightforward because we are just building on large foundation models with perhaps more focused training and fine-tuning and tooling. But at the same time, this is the use case where we have to be extra careful in terms of understanding how to monitor and how to govern and how to make sure that these AI technologies are used properly because of the potential of it directly impact care decisions. Right? So the second use case where this new wave of technology can advance healthcare is in driving new discoveries at scale. So for example, accelerated discovery of therapeutics for the many very serious diseases for which there's still no cure. Right? So this use case has a very different flavor because on the one hand, technically it's more challenging because here we need to really advance foundation models way beyond the large language models to be able to learn from more different modalities and to actually combine these modalities together, right? So in many cases, we don't know how to do that yet.
Yeah.
On the other hand, I think in this case, the issue of governance is less challenging because we know better how to govern the use of AI models for in the case of scientific research, right? Because we have been doing it for a much longer time.
Well, that's fabulous. So if you talked about the difficulties about actually deploying them and what we have to be careful about. One aspect there is certainly also explainability. That's of course a keyword that's thrown around a lot these days. Usually it's not even explainable to whom, right? The machine learning practitioner, the physician, the patient, the nurse, for whom actually. So how do you think about practical explainability for example, foundation models or deployed models?
Yeah, that's a really good question, and you're absolutely right. Explainability has different meanings to different people and has many different roles depending on the model, the end user, as well as the context of use. Right? So for AI foundation models, I think there are two roles that explainability can play that's particularly important. The first one is, I think, explainability can enable more systematic ways of exploring and establishing boundary conditions and failure cases. For foundation models in particular, right now it's done in a ad hoc and haphazard way because we all know about those famous examples of bizarre behavior that tools like ChatGPT can have when different people poke at it in different ways. But because we don't really know how these models work yet, I think we're far from being able to establishing the real boundaries, right? And that could be dangerous because even though similar level of lack of explainability exists for other types of machine learning models as well, the stakes are particularly high for foundation models because of their extraordinary power. Yeah. So the second role, I think explainability can play in the case of AI foundation models, particularly when we try to put foundation models to use to drive scientific discovery, is that it could lead to more actionable insights. Yeah. So, in this case, for example, by combining our human knowledge, either in the form of knowledge graphs or mechanistic models, you can actually generate the type of explanations that can lead to more actionable insights. So for example, we in a recent work, we demonstrated that when we combined a machine learning model, in this case, it's generative adversarial networks, with a mechanistic model for cardiac tissue function, we were able to arrive at insights that shed more light on the potential mechanism of action for a particular therapeutic agent. So this kind of insights can lead to more precise safety and efficacy profiles that can lead to more effective de-risking of therapeutic candidates before you take them to expensive clinical trials, right? So, using foundation models, we potentially, by combining this kind of approach, we can arrive at this kind of active, more actionable insights at much greater scale.
Well, that's fabulous. So if you think about the frontiers of this technology, you talked a little bit about how it can drive research. In application, you mentioned cardiology as an example. But beyond that, where do you think foundation models will have the biggest impact in healthcare next?
Yeah, so already this latest wave of AI technology, particularly foundation models and generative technologies, is already well poised to drive, enhanced productivity, as we discussed, and some aspects of research. And I think the next frontier really is in how do we harness this power to then drive new scientific and engineering advances that can help us address some of the most challenging problems in clinical research, right? So for example, how do we connect different modalities to come up with a more holistic view of the health state or the disease state, right? Because human body really is driven by human physiology, is driven by really intricate and complicated interactions that takes place over time, right? So how do you build models to actually capture these interactions so that we can drive more holistic view of both understanding of diseases and also therapeutics development, right? So having a model like this, which most likely will require, again, learning from multiple modalities and learning across different modalities, could potentially really finally allow us to take a different approach to therapeutics discovery, a more holistic approach. For example, focusing more on early stages of pathological development that could have impact on many downstream diseases instead of treating symptoms when it's already too late to reverse the disease course.
That's fabulous. You're really describing a beautiful future where AI can have drastic impact. So Dr. Hu, thank you so much. Thank you for joining us at the conference, and thank you so much for the conversation.
Thank you very much, and thank you for having me.